All right, this is the special test for the ankle for MS2. So the first test is an anterior drawer. So for this one, we are stabilizing at the distal tib fib. We are then taking the calcaneus, putting a little bit of it into dorsiflexion, and then applying a posterior to anterior force up. And we're assessing for any ATFL instabilities with this. My sister is normal. The next is a Taylor tilt test. So with this one, we're still stabilizing at that distal tib fib, but instead we are applying an inversion force. And with this, we are assessing to see if there's any instability at the CFL. Hers is normal. Next is the syndesmotic ligament sprain. For this one, the primary test that we use is a dorsiflexion, external rotation, and eversion. And we're seeing if she has any pain reproduction at her syndesmotic joint. And the secondary test to that is doing a squeeze. So it's the syndesmotic squeeze. So we start about mid-calf, and then we squeeze, no pain, then we squeeze down a little bit farther, go down, and any pain with that?
No.
No. Next is the Achilles rupture test, or the Thompson test. So I'll flip you over onto your stomach for me, please. So with this one, we are squeezing the calf and we are looking for any plantar flexion. So if the patient does not have plantar flexion, then they may have an Achilles rupture. So we squeeze, and as you can see, her toe goes more into plantar flexion when I squeeze it. Next one is Morton's neuroma. Can you flip back over on your back for me? So with this one, we are squeezing all of the metatarsals together, assessing for any paresthesias that the patient may be having that happens with Morton's neuroma. We're also really going to be looking at metatarsals 3 and 4 and palpating those to see if that reproduces any of the patient's symptoms. Next is the tarsal tunnel. So what we're doing, similar to the carpal tunnel, is we're just tapping. So this is Tinel's, and we're trying to see if there's any paresthesias or symptom reproduction stimulated by the tibial nerve that runs posterior to the medial malleolus. Next, we're going to do the figure 8 test. So this is for global edema. So we want to be using the centimeters. It's a little bit easier. So we start right at the syndesmotic joint. We are wrapping around the lateral malleolus, the medial malleolus, if I can keep it straight. We're going down to the cuboid on the lateral side, wrapping around and hitting the navicular, and then coming back. So my sister is at 47 centimeters, and then I would compare that to the other side to see if one was more swollen than the other. The last one is the windlass test. So for this one, I am dorsiflexing my sister's toe, and what I'm assessing for, if you could actually just pull your foot out to the side, is to see if that arch raises up, which hers does. So that's a medial longitudinal arch, which means that her windlass mechanism is intact. That concludes this video.